One of the biggest myths that I have got to dispel right now about pain and behavior is that you should rule out all medical problems, including pain, before you touch the behavior. But you know that pain has an emotional component. And also, as veterinarians, why would we ever let an animal suffer when we can relieve suffering? Most of the behavior medications that we use will not interfere with the testing that you will be doing to find pain, such as CT, MRI, X-ray, ultrasound. Okay, so go ahead and dispense those anti-anxiety medications right along with those pain medications. Always check the interactions to make sure you're being safe, but do not wait to relieve anxiety or fear or stress until you complete those medical tests. What is also really interesting is that there's crossover between pain medications and behavior medications. That's kind of cool, right? The same medications can relieve pain and anxiety. Think of gabapentin or pregabalin, for example. So opioids not only relieve pain, but they also can relieve the stress, specifically the stress of separation-related behaviors. The International Association for the Study of Pain, now that's a human organization, states that pain has an emotional component by definition. And you know that because you know that you have different pain tolerances than, let's say, your friend does. And it's the same for animals. One of the things that always rises to the top of my mind when I talk about pain tolerance is my personal experience. That's a picture of my swollen ankle, and on the right side is a picture of me after I ran a 2-day 30-mile race on 2 torn tendons in my right ankle. It sure would seem like that would be a painful experience, but on those 2 days, somehow it wasn't as painful as it was before or after. Pain is perceived. There are studies that show that it's the same in animals too, that actually their personality type affects their pain scores. So in this study, dogs were scored with validated pain scoring measures, and their pet parents were asked what they thought the dog's pain scores were. And what we see from this study is that not only does dog personality affect pain, so more extroverted dogs had higher pain scores, but pet parents were not good at predicting whether or not the dog was painful. That makes sense, right? Because you can predict how painful I might be at any given moment. So only the patient knows their individual level of pain. That presents a problem because how are you as the veterinarian going to find that pain when the animals cannot directly speak to you? We know that our physical exams are not the end all for finding pain, and in cats we know that they're not even good for finding pain. Lots of vets tell me, I hear you, you want me to find pain, but I cannot get near these animals. One of the things that I teach my residents is a touchless physical exam. That means by observation. You can see nail wear, you can see muscle asymmetry, you can see if that animal sits or stands in a structured way. You can have the pet parent ask them to sit and stand up to watch whether that is easy for them or more challenging. You can ask them to do that on a slick floor versus on a mat. There are tons of things you can do in addition to that to assess pain that do not require you to ever touch the animal. In this study, looking at 12 dogs who were presented for the problem of aggression, 2/3 of those dogs had hip dysplasia and pain, but they were not aggressive primarily when they were touched over the hips. The dogs who showed their aggression first after the onset of pain, so no aggression before, those dogs were actually more likely to be impulsive, show defensive body postures, so they were trying to say, hey, stay away from me before they were actually touched, and they were more likely to be aggressive when manipulated. Several studies showed that dogs with atopic dermatitis are more likely to have many behavioral clinical signs and are more likely in general to have behavior problems. It makes sense to me. If you're itchy all the time, you're going to be a little irritable. It's also going to be distracting for you, so it's going to be hard to learn. Another thing that I hear all the time is my dog's licking, it must be anxiety. Maybe, but probably not. Probably it is dermatologic disease. But there's another big one that comes into play, and that's nausea. There was at least one study in dogs that showed that dogs who excessively lick actually have signs of inflammation in the gastrointestinal tract, and over half were cured by treating those particular problems with the GI, not with the anxiety. So if your animal is licking, go ahead and go to your vet, but ask for a GI workup and a derm workup. Look, many of our patients are painful. I think up to 50% of the ones that even get to me, and in some vet behavior practices, it's 82%. Hunt down that pain, relieve the pain, the discomfort, cure the physical disease, and treat the stress. If you do those things, you probably will be referring a lot less behavior cases to me.